Scripps is at the forefront of a new era in medicine, with breakthroughs that are transforming healthcare today and for generations to come. From innovations in minimally invasive surgery for heart and cancer to discoveries in human genetics and wireless health technology. It's extraordinary advancements like these, coupled with the expertise of Scripps heroes, the physicians and nurses who bring a world of healing to patients and families every day. It's our promise to our patients to care for them when and where they need it most.
All 13,000 employees and our almost 3,000 physicians are focused on one thing every day, and that's taking care of each patient one at a time. These are the healthcare heroes that save lives, and there's no question about that. We're also focused, though, on meeting the future healthcare needs, and we're also focused on our past.
In 1924, philanthropist Ellen Browning Scripps recognized the need for quality healthcare for her family, friends, and neighbors in the small seaside community of La Jolla. She provided the funding and determination to open Scripps Memorial Hospital and Scripps Metabolic Clinic. Decades earlier, Mother Mary Michael Cummings arrived in San Diego with a similar mission to provide care and compassion to those in need. In 1890, she opened Mercy Hospital in downtown San Diego. The Scripps Health of today is the living legacy of these visionary women, underscored by Scripps' mission, vision, and values to put the patient at the center of everything we do.
Now, hospitals actually have to be built taller and the rooms larger because of the technology that's built into the facilities to take care of the patients. So for us to succeed and for us to deliver, again, the highest quality care and the safest care, we must grow to meet this community's needs. And grow we will, because again, that's our promise.
That promise is kept daily on 5 hospital campuses and nearly 24 outpatient centers throughout the San Diego region by more than 13,000 employees and 2,600 physicians caring for 500,000 patients every year. Scripps has been recognized as a leader in heart, stroke, and cancer care, orthopedics, integrative medicine, and genomics. And Scripps has been honored by Fortune and AARP as one of the nation's best employers. All thanks to our people.
We will get the best and the brightest because starting at the top, the leadership of Chris Van Gorder, what we have done in terms of the management of the system, the financial stability of the system, the great place to work, having the dollars to invest in technology and bricks and mortar. You have to have that if you're really going to get the best people. And I think we have all the ingredients.
And key ingredients include Scripps graduate medical education programs, which are training the next generation of young physicians today to care for our community tomorrow.
We have graduate medical education at Scripps Green, at Scripps Mercy, growing at Scripps La Jolla. So we're training excellent young physicians. These programs are as competitive as any of the country.
It's these physicians equipped with innovative technology who save lives. Scripps' minimally invasive robotic surgery programs are changing and improving the care our patients receive.
Robotic surgery has brought great outcomes now to surgical diseases throughout many subspecialties, so that it's not only applied in urologic surgery, but gynecology and cardiac surgery as well. In our cancer field of urology, it really has been revolutionary. And now we can do these types of surgeries through much smaller incisions, with much greater precision, with better outcomes, and to the patient that they get out of the hospital quicker and back to their lives quicker. That's the goal.
Steve Fisher, San Diego State Aztec basketball coach, knows firsthand the benefits of robotic surgery. He's back on the court with the team following prostate cancer surgery.
I'm old school, and I was the last one on the block that had direct deposit of my paycheck. I wanted to feel it, take it into the bank, and put it in the bank myself to know that it was there. And I think the same thing about this. I wanted a doctor to touch me. I didn't want a robot to touch me. But as you look and see what this world is all about now, and I think those of you who are in the medical field know that what's happening with the robotic surgery is going to be the thing as we move forward, probably for every form of major surgery.
This expertise in caring is evident across the Scripps system in all we do. More than 10,000 babies are born every year at Scripps hospitals. That includes 1-year-old Van Clausen. Van, his mother Miranda, and father Bryce are reunited with the physicians and nurses who cared for them when Miranda experienced a rare amniotic fluid embolism during Van's birth.
Hello!
Hi.
It is a joy coming back and being able to see everybody and be recognized by people and know that they played an integral role in our health and Miranda's life.
I don't think anyone ever anticipates anything quite so severe to happen, but when something did so rare happen, everyone here pulled together, and we're extremely thankful for how fast everybody was able to recognize what was happening and had the right skill sets to, whether it was CPR or whether it was the blood bank and having enough blood on hand to replenish the blood, to the echocardiograms, to notice right away this rare condition.
At Scripps, it's not just about treating disease. It's about preventing it in generations to come. And the groundbreaking research underway in genomic medicine and wireless health monitoring will revolutionize not only treatments, but also how disease is prevented.
In your health history, have you ever been diagnosed with any cancer?
We're unlocking the secrets of healthy aging through the Scripps Welderly study, solving complex genetic puzzles, and building one of the largest genomic repositories in the world.
I've got the long-lived genes, which apparently help me resist a lot of diseases that other people are susceptible to.
These healthy elderly or welderly patients are susceptible to major chronic health conditions, yet remain protected from disease.
Ultimately, if we can now sequence all these people's genomes, which is what we're in the midst of right now, we do expect to find specific genomic data that tells us how they're protected. And that is a segue to all sorts of things, like the potential drugs, vaccines, treatment strategies, prevention strategies, the likes of which we don't have at all today.
Always looking forward, Scripps continues to grow to meet our community's needs. From the expansion projects on each of our campuses to our plans to build the Scripps Cardiovascular Institute, which will be a leading heart hospital on the West Coast. We are proud to be on the forefront of medicine and patient care.
Well, these are very exciting times in healthcare. We've never been in a time period where there's this much innovation. One example is, here's a Band-Aid. That's a wireless Band-Aid being developed right now that'll monitor a patient's full vital signs. Or here's a pill with a little tiny chip inside the pill that'll be activated by the stomach acid, and it'll send a message to the doctor for about 5 minutes that you in fact took your medicine on time. So these are just two of what are hundreds, if not thousands, of innovations that are being developed right now that will lower the cost of healthcare and improve its safety and quality in the future, and we're at the front end of all of that.
And at Scripps, these innovations lead to life-saving rewards.
If I had to tell my own son, here's where you go, it would be right here with Scripps, without question.
A huge thank you. That's Van's way of saying thank you.
Someday he'll be able to vocalize it for real.
But we do love everyone at Scripps, so thank you from the bottom of our hearts.
These people and many others know firsthand why Scripps is synonymous with medical excellence. We are ushering in a new era of medicine where robotic technology and wireless medicine are coupled with a human touch, where research extends from the laboratory to our patients, where unexpected traumas are treated quickly with great expertise and care, and it's where new family members are first welcomed into the world. At Scripps, it's our promise to the community to bring a world of expertise and a world of healing home to you.